Good afternoon to one and all present here. Myself, Dr. Sangeeta Kalita, and my AIOS number is K18831. So I'll be speaking on posterior fixated iris claw lens versus sulcus fixated intraocular lens in absence of capsular support. There is no financial disclosure in this presentation. The purpose was to evaluate visual outcome and complications of posterior fixated iris claw lens and sutured sulcus fixated PCIL in cases with no capsular support. Single surgeon setting. It is a retrospective study of 47 eyes which has undergone primary implantation of posterior fixated iris claw lens in 23 eyes and sulcus fixated IOL in 11 eyes, and secondary implantation of iris claw lens in 8 eyes and SFIL in 5 eyes. All the cases, irrespective of gender and above 18 years, were taken from July 2016 to 2017. Patients with any other ocular pathologies, corneal, macular pathologies were excluded. Indications for surgery included subluxated or dislocated lens dislocation caused by various reasons like Marfan syndrome, intraoperative complications during phacoemulsification and ICC, and ocular trauma. The surgical technique was in the first group in iris claw lens, single piece biconvex PMMA iris claw lens with length of 8 mm and 5.5 mm optic size was enclaved to retropupillary iris using iris spatula and iris claw IOL holding forceps following anterior vitrectomy through limbus. And SFIL, the surgical technique was single piece biconvex PMMA IOL of 13.5 mm length and 6 mm optic size was inserted through 6 mm long sclerocorneal tunnel, and tips of the trailing haptic was externalized and tucked into the scleral tunnel using Hoffman's pocket. The results were determined by measuring the visual outcome and complications of the surgery. Now this is it's not coming. So this was a very hard cataract, and so during surgery, while removing the last piece, the whole back came out actually. So in that case, we did the anterior vitrectomy and the iris claw lens was put, it was tucked first laterally with the IOL holding forceps, and then the other side was tucked with the iris spatula or Sinskio. This was the post-op day 3. Okay, and the results of this study was overall 60% of the eyes with primary implantation had visual outcome better than 20/40 in both the lens types. 78% posterior fixated ICIOL group and 58% SFIL group in secondary implantation had visual acuity better than 20/40. Post-operative complications included retinal detachment in one case in SFIL case lens types in primary implantation group, and ovalization of pupil in ICIOL group, and dislocated IOL in one case of SFIOL. Now coming to discussions, the incidence of inflammatory reactions was found to be extremely low in the iris claw lens. Vitrectomy could be done with limbal approach, and the technique was very simple. On the other hand, the scleral fixated PCIL it is a challenging technique, and the risk of complications such as IOL tilt and suture erosion, it was a long-term complication, it is quite high. Special caution should be taken in cases of scleral fixated ICIOL in case of myopia, hypertension, scleritis, and scleromalacia. Risk of complications correlate with increased surgical time like corneal edema, and risk of infection was also more because of the sutured procedure. Now, coming to conclusion, iris claw lens can be safely used as an alternative to SFIOL. The limitations of the study was sample size was small, follow-up period is variable and of short duration, and IOL centration could not be assessed using UBM direct visualization. Thank you.